This video is to introduce you to what reactive lymphocytes appear as on peripheral blood morphology. Here in this field we see two lymphocytes, each of which shows expanded cytoplasm that more or less hugs the red cells surrounding the lymphocytes. You'll also note that the areas where the lymphocyte is hugging the red cell, the cytoplasm becomes a dense blue color. Even within the lymphocyte, there are areas of increased density of basophilic color. Additionally, the nucleus appears to have more smooth chromatin and perhaps even a faint nucleolus and is somewhat enlarged. All of these features taken together are representative of a reactive lymphocyte, and to the untrained eye can be easily mistaken for an immature blast cell. One difference between these reactive lymphocytes and a blast cell is the amount of cytoplasm. Typically, lymphoblast cells will have very scant amount of cytoplasm and a very round appearing nucleus. As we scan around, we see many different lymphocytes with different morphologies, including this one here showing granulation of the cytoplasm. As we zoom around, we see that many of the lymphocytes in this patient's peripheral blood morphology appear reactive, and these large lymphocytes may occasionally burst in the peripheral blood morphology smear process, creating these smudge cells. In this case, the patient has a diagnosis of mononucleosis, and the reactive cells are, in general, T lymphocytes. T lymphocytes are more likely to have this granulation, as well as NK cells. This example highlights those features that I explained earlier with the expanded cytoplasm, the relatively immature appearing chromatin, and the hugging of the adjacent red cells. Occasionally, this density of the cytoplasm can show an alternating pattern, which may look like waves in a sea, or the undulation pattern of a dress as viewed from above. Here are some more examples of these reactive appearing lymphocytes. Some show granules and some do not. And correlation with the clinical history is important for making this diagnosis. Lymphocytosis in reactive clinical conditions are primarily associated with infections, classically with mononucleosis, as well as other viral infections, stress, trauma, and drug hypersensitivity reactions. It's important to distinguish this reactive process from a hematologic malignancy, which may also show an increase in the lymphoid cells, including chronic lymphocytic leukemia, any lymphoma in the leukemic phase, post-transplant lymphoproliferative disorders, and acute lymphoblastic leukemia. You will always want to check your ancillary studies before making a diagnosis of chronic lymphoproliferative disorder on a peripheral blood smear alone. Morphology can be helpful, but is typically not specific for any one entity.